Well, hello, everybody. Episode 7 of MD plus DVM is coming to you live right now. It's myself, Dr. Kim, and Dr. Priscilla.
Hello.
Hey there.
Hey.
And so today's episode is all about skin. Skin. So I've kind of given away our first question. What is the largest organ of the body? And hopefully you guys know the answer is your skin. Wow, not your liver, not your large intestine, or selfishly the brain that I would think of, but your skin. So we're going to talk about the importance of skin and why we as humans and why our pets need to be protected, because it's one that is exposed to the elements the most, exposed to outside factors, toxins, what we eat affects it, our stress levels affect it. So it's something that can really wear what your health, what the inside of your body's doing, the outside, your skin kind of gives away what's going on the inside. So before we get to our guest, and Dr. Priscilla is going to introduce our guest here in a moment, we kind of wanted to give a moment of seriousness and empathy to all of our guests or all of our viewers out on the West Coast. I think Dr. Priscilla, I know it's not just California, there's other states that are having problems too, right?
Yes, Oregon, and I believe Washington is too. I know it's just up and down the West Coast. Yeah.
So and even like Nevada and New Mexico, Montana, Idaho are having even minor fires. So it's very serious. I know some people have said that, oh, it was because of a gender reveal party, or it's because they're not sweeping or not doing whatever. This is like environmental. This is what's going on the earth. And we have that. We have people bracing for another hurricane in the New Orleans area, and Louisiana and Alabama, Mississippi, that whole area, the panhandle of Florida are all bracing for, I think, Sarah, maybe?
I think so.
Sally? Sarah.
It's that season. It's that season. As we talked about last time for disaster preparedness, you need to be ready, you and your pets. So I think we have a lot to talk about today.
Yes. So let's get to the show. So we want to introduce our guest, Dr. Priscilla. We have a dermatologist, a human dermatologist, and then a veterinarian that specializes in dermatology needs for pets. So take it away.
Okay, wonderful. So right before we get started, we always do our disclaimer. We are medical professionals, but these opinions are our own and not of those of our employers. And we want to thank you guys for joining us and for subscribing to MD plus DVM. You can click on subscribe and tell others about it, because we are excited to share this information with the world. When we bring human medicine and animal medicine together for one health, I mean, it's something novel, it's something new, and we're excited to collaborate. Also, we want to thank our sponsors, Kindred Momentum, Hammond Animal Hospital, Pet Nugget, and Bowen's Neurology and Neurosurgery Service, and the American Association of Black Veterinarians. So let's get started. We're talking about skin today, and we have two wonderful doctors. We will start with the human side. We have Dr. DiAnne Davis, who's a medical doctor and a fellow of the American Academy of Dermatology. She's a board-certified cosmetic dermatologist, and she specializes in non-invasive facial rejuvenation, skin of color, and she's going to talk to us more about what that means, hair loss, and cosmetic dermatologic surgery. She is a proud undergraduate of Tuskegee University, which is where we actually met. And she also has her Master's of Science degree in cell and molecular biology from Tulane, where at that time, while she was getting all good grades and learning to be awesome, she also was a Saint-Sation cheerleader with the New Orleans Saints. So she is multi-talented. And then she went to DC to the George Washington University to receive her MD. Now, she went through all the rigorous training that specialists go through. She completed her residency at the Oklahoma Health Sciences Center, and she was chief resident there her final year. While she was there, she actually coordinated the first Skin of Color Symposium. She's a co-founder of Sunblock Kids, which hopes to bring awareness about the importance of sun protection at an early age. And she's worked with over 70 types of lasers on skin. Dr. DiAnne has done a lot of wonderful things, and I can go on and on and on, but I will let her, instead of me telling you, you can see all of her education and training come out when she joins us. So we're glad to have her. And she is a native of Oklahoma City, Oklahoma, and wants everybody to know that. She's very proud of that. Up next, we have our veterinary dermatologist. This is Dr. Tomeisha Hubbard. She is a native of Birmingham, Alabama. She also graduated, well, her undergraduate was from Talladega College, and she went to veterinary school, the same place I went to veterinary school at, again, Tuskegee University. You're noticing a trend here, okay? But Dr. Hubbard actually has her own practice of the Alabama Veterinary Allergy and Dermatology Service in Hoover, Alabama, a satellite practice in Huntsville, Alabama, at the Animal Emergency Clinic of North Alabama. And she's also a clinical professor of veterinary dermatology at Tuskegee University College of Veterinary Medicine. She serves in her community. She is the president of the Tuskegee Veterinary Medical Association. She's also a member of the American Academy of Veterinary Dermatology. She also has tons of other organizations and accolades. These are wonderful, wonderful doctors that we have on. So we're going to go ahead and bring them in and let them share with you. And they're coming.
Here they come. Hey.
Hello. So we have, hello. Hi, Dr. DiAnne.
Hello, good afternoon. How are you?
We are doing great. And hello, Dr. Tomeisha, how are you doing?
Hello, doing great.
Hello.
So, Dr. Kim, you want to take it away? I just introduced these wonderful, amazing doctors who specialize in the area of dermatology, the largest organ that you pointed out, Dr. Kim, in the body. So, Dr. Kim, did you want to take it away on the wildfires? Let's start with that conversation.
Yeah, so the wildfires. So I know that a couple of my friends who live on the West Coast in like San Francisco and LA were saying that they've noticed that, of course, they're wearing their mask indoors because of the coronavirus, but now they're having to wear their mask outdoors because of the poor air quality of because of the wildfires. And everybody's seen those pictures of San Francisco being red, the red skies. And so what type of dermatology or dermatological problems can we run into with poor air quality and just pollution in general?
So that's a really good question. I'll go first because I will talk about the human skin. And what happens when we have poor air quality or pollutants is that there are a lot of oxidative stress that is caused not only on the environment, but on our skin cells. And so with oxidative stress, what happens in particular is that it can start to lead to a lack of blood flow to certain areas of the skin, even ultimately even a lack of blood flow to even more vital organs. But from a skin perspective, what that does is it can sometimes slow down wound healing whenever there possibly could be an injury to the skin. So even, like for the firefighters and the people that are out there kind of fighting, the smoke and the pollutants, if they happen to have an injury, a cut, scrape or whatnot on their skin, then of course that can slow down the healing process, ultimately leading to poor wound healing, delayed wound healing, or even risk of infection. When you think about it from a skincare perspective, just with our overall skin, oxidative stress on the cells also results in a breakdown of collagen. Collagen and elastin are the building blocks that give our skin the plumpness and the rejuvenated appearance. So when you start to have a breakdown of those building blocks, then you start to have skin that is more aged. It has a lack of luster. It doesn't look as vibrant or rejuvenated. And it overall just makes you look aged and tired.
Wow. I don't think a lot of people think about that when it comes to how the skin is infected. They may think about the respiratory system and things of that nature, the eyes, ocular. Kind
of like an accelerated version of what happens when you smoke cigarettes, because like you can always tell when someone is a cigarette smoker. You can tell by looking at their skin, because their skin doesn't have that. It just has that look. It's a different type of look.
Yeah, thin, it's kind of crepey, a little bit more wrinkly, the texture can even sometimes be leathery, depending on the length of time that they have been smoking. And so that can also correlate to if you're around, certain pollutants, if you're around smoke environments, then that can also correlate with how your skin looks.
What about our pets? From a pollutant standpoint, how does that manifest in a pet's skin and overall outcoating?
So it definitely, the smoke, the pollutants can act as an irritant to the animal skin as well. So they can penetrate through that hair coat and get down to the skin and act almost like a contact allergen. And so if there's a contact allergen, then it can cause the skin become red, inflamed. It can dry the skin out, and they can just actually have like an adverse reaction to the pollutants. And so we definitely don't want our pets to be in those environments because it can damage the skin. And as we said, it can also contribute to secondary bacterial infections on the skin, which will also decrease wound healing. So it is very similar in veterinary medicine as on the human side, but we think of it as more a contact irritant of the skin of the animals.
And one word that you used, Dr. DiAnne, was oxidative stress. So I want us to really focus on that word because I know some of our viewers are probably thinking, what is oxidative stress? And so when you think about it, though, viewers think about antioxidants and why you want to take and want to ingest antioxidants. So can you kind of break down that word oxidative for us?
So with oxidative stress, it just means that essentially your cells or your building blocks aren't working as efficiently as they should. There's something that is, kind of affecting their machinery, if you will. So from a skin perspective, our skin naturally has a turnover rate because our skin naturally sheds a certain number of days. Yes. With oxidative stress, what can happen is your skin is constantly turning over. And so as your skin cells shed off, there's new skin cells that are coming up underneath. But with that oxidative stress, you start to mess up those building blocks and proteins that start that process of the new skin being regenerated underneath. And so then that starts to throw essentially that balance off. And so then you don't get fresh, rejuvenated skin. You have more old skin that's staying on top of the skin and clogging the skin and resulting in pores or developing rashes, things like that.
So I think that kind of gets us into something you mentioned at the very end of that, pores, rashes. So what can lead to things that, like from an acne standpoint, what actually happens when someone has that clogging of the pores? What can happen?
True. Okay. So it was a very good segue because what happens with acne, first of all, is that we have our skin cells that stay stuck on top of each other. So you have more adhesion of the keratinocytes, if you will, that's the medical term, but of your skin cells. As they stick on top of each other, then of course your pores become clogged. As a result of your pores becoming clogged, you start to have inflammation of your sweat glands or your sebaceous glands that are underneath the skin. And so whenever there's inflammation, you get irritation. And so underneath the skin, you start to have this kind of perfect storm where you start to get these inflammatory lesions that start to appear on the surface, which are your pimples. So it's a little bit of a combination of your pores becoming clogged. There's inflammation underneath the skin with your pilosebaceous unit or your sebaceous glands. There's also a particular bacterium called P. acnes that also loves to play in this perfect storm. So you have this, again, this whole party of all of these mediators that leads to acne that presents on the skin. Sometimes when it's primarily the pore clogging that is the kind of primary generator of acne, then you'll sometimes see open or closed comedones or whiteheads or blackheads. So again, that's the clogging of the pores. When you tend to have more of the inflammation that's happening underneath the skin, then you will sometimes get the more kind of red, juicy pimples that appear on top or maybe even have a little bit of pus in them. So that's going to be more of your inflammatory acne. And whenever there's sometimes a hormonal component involved, then you can sometimes get those deep, tender kind of nodules that are underneath the skin. You can't really see them, but you can feel them. And so that puts you into the nodulocystic category of acne. So there's different types of acne. Oftentimes I find a lot of people have a combination of one or the other. But it just is a process of all of that happens.
Well, I know someone that I need to refer to you, but we'll talk offline for that. I don't want to reveal that.
I'd be happy to see them. I'd be happy to see them.
So do pets get acne? I mean, what's one of the common things that we see for pets?
I was just going to say, before you answer Dr. Tomeisha, I will say one of the most common things that I saw, other than flea allergy dermatitis, which I want you to talk about too. Yes, because I get asked at my current job as an attorney, people see that I'm a vet on my signature, and they were like, my cat was itching near the base of the tail, and they're losing hair. And I'm like, are you treating for fleas? They're like, it can't have a flea. Anyway, we're gonna get to that. But before we get to that, I used to see a lot of cat acne on the chin, and I know there are different types, but could you speak more to that? Because I would see owners, I would see cats come in with these little black bumps on their chin. And can you speak to some of the common acne in pets?
Right. So we definitely see acne more commonly in cats, and we're going to see it on their chin. And so it takes on like a black discoloration. And so they are those same plugged hair follicles, those comedones that we were talking about. And sometimes it can be a keratinization disorder, or it can be an infection, a secondary bacterial and or yeast infection that's contributing to that issue. And so it causes the cat's chin to be very itchy. And sometimes we'll see it as a result of owners feeding their pets out of like plastic food dishes. And so bacteria can build up in the plastic in the dish. And so when those pets' chins rub against the plastic, it can cause that type of acne to form. And so we normally want to address that by treating the secondary bacterial infection. So we can prescribe an oral antibiotic in order to get rid of the bacterial component. We can even prescribe something like a benzoyl peroxide, which is follicular flushing. It flushes out those follicles and gets rid of the debris that collects in the follicles. And so we'll ask owners to clean their pet's chin with like a Stridex pad or something to get rid of the acne. But it's very similar. There are definitely correlations between the human and the veterinary medicine, but we normally see acne in cat patients.
Now, I have a follow-up question. Do you normally recommend that they change their feeding bowls from plastic to steel? That's something that
I usually would recommend that they change to a stainless steel or ceramic bowls instead of the plastic bowls. So we can see a contact irritation in dogs as a result of the plastic bowls as well. So we do encourage owners to change their bowls to stainless steel or ceramic.
So you mentioned treatment. So from a human side, there's so many different treatments out there. Noxzema, you got Neutrogena, you got all these other ones out there. So what would you recommend for like a basic, not even product name, but basic treatment for someone who has maybe a combination of that type of acne, or a teenager who has like the hormonal stuff going on?
Sure. So like Dr. Tomeisha said, I do love benzoyl peroxide as a cleanser. It really helps to cleanse the pores and really just help with that clogging effect. So I usually have patients use either benzoyl peroxide or salicylic acid cleansers are another one of my favorite cleansers that I think do a really good job of cleansing the skin, and really counseling patients to do it twice a day. I often find sometimes some patients still will just wash their face once a day. And I tell them, look, there's even oils and buildup that's on your pillowcase. So in the morning, even though you washed your face at nighttime, you have to wash it again in the morning before you leave the house. My second favorite treatment for acne is going to be a topical retinoid. So it's a vitamin A derivative that really helps to normalize the way our skin cells naturally shed. So it's a chemical exfoliant, if you will, but it packs a major punch when it comes to really treating acne, because it's going to help to clear up the acne that patients already have. It prevents them from getting new pimples. It also helps to fade the dark spots, because especially in skin of color, sometimes it's not the acne pimples or the blackheads that cause us frustration. It's the brown spots that are left behind.
Yes.
So a retinoid can also really help to even out the skin tone as well. And then of course, I always will add in a sunscreen. You can't come to a dermatologist without talking about sunscreen. It's also extremely important in acne because again, the sun can stimulate the production of melanin or pigment. So if we're trying to correct pigment, I cannot correct it if we're not protecting it with a sunscreen. But I like a good cleanser. I love a topical retinoid. And then sometimes for my younger patients, especially teenagers, they will sometimes have acne not only on their face, but their chest and back. That's where, like Dr. Tomeisha, I like to add in an antibiotic, usually orally, because then I can kind of treat them from the inside out and get clearance on other areas of the body as well.
So, you know, you mentioned the antibiotics, but you also mentioned what was the thing that you just mentioned? It was antibiotics.
Was it the retinoid?
Yes, the retinoids. So are those things that are can women take those? Are there precautions that we should have if you want to go out, because they're available over the counter? What precautions should we take?
Correct. They are available over the counter, and there are also retinols or retinoids. And so your retinols are going to be milder strengths. They're more readily available over the counter. What happens is that it takes a 2-enzyme conversion for a retinol to become a retinoid. Okay. So when you purchase those, your skin has to go through a little bit of an enzymatic process for it to be absorbed into the skin, but it's usually not as irritating. Retinoids are already in their most active form, and so it doesn't have to go through an enzymatic conversion. The thing is that oral retinoids are contraindicated in pregnancy or if someone is trying to get pregnant. That's because of taking them systemically, it can definitely cause birth defects. And so we counsel patients on that. Topical retinoids also are, we usually refrain from using those in pregnancy just because of the effects that the oral form can have on an unborn fetus. There have not been a lot of clinical studies that have shown that the topical retinoids, at least to my knowledge, that the topical retinoids will cause harm. But again, because of the oral form, then we're very cautious in pregnancy and prescribing it to someone who either is pregnant or they're planning a pregnancy. So that's the kind of one of the big precautions that I have to explain to patients. So if it is a young woman, you know, who is of childbearing age, sometimes I may have to ask them, where are we on the family planning spectrum? Because then I have to tailor the treatment to that. The topical forms otherwise though are safe to use as long as you use them under the guidance, you know, of your physician or dermatologist. The one topical retinoid that is prescription strength that is over the counter is Differin gel. Differin. It used to be prescription strength, but because it's the mildest form of a retinoid, it has now become FDA approved to just be dispensed over the counter. So oftentimes, if I tell someone if they want a mild form that's over the counter, that's the one I recommend because it's already in its active form. And to me, it's more effective than sometimes the retinols.
Okay. The sunscreen question that you brought up, using sunscreen. And I know for our humans, you know, for us, sunscreen. For animals, there's also sunscreen out there as well. So, I mean, at first, let's talk about the animals. And then next, I wanted to kind of focus on sunscreen for African Americans, because I know those of us of different hues and beautiful different colors of brown. Some people might think, well, I've never gotten a sunburn in my life. Do I need to wear sunscreen? Some people...
They just say they don't need it.
They don't. True. They really feel like they don't need it because they've never gotten a sunburn. So not animal, because we're all animals, but from a pet standpoint, what do you think for sunscreen? What should we talk about with our pets?
Yeah, because that's not something people commonly think that even pets should wear either. So Dr. Tomeisha, can you talk about that?
Yes. So usually when we're prescribing sunscreens, it's for those lighter colored animals that don't have as much pigment in their hair and in their skin. We want to protect them from the sun. So there are some pets who like to go outside and sunbathe. And so they like to lay out on the deck with their feet up in the air and just enjoy the sun. And that's not a good idea for a light colored pet because they can end up contracting squamous cell carcinoma, which is a type of cancer, a type of skin cancer. So it usually starts with precancerous lesions that we refer to as actinic keratosis, and then it can progress as they're more exposed to the sun. It can progress into squamous cell carcinoma, which it can be malignant and potentially metastasize. But we normally encourage those owners who have pets with lighter colors who like to go outside and sunbathe to use a animal safe sunscreen. And some of the human sunscreens are safe as well. But you know, SPF 30, SPF 70, whatever. We do encourage sunscreens for those patients that like to sunbathe.
Do you feel comfortable telling our viewers what types of sunscreen? And, you know, some people, when they use sunscreen, they like to lather it all, just go crazy with it. So are there any precautions that people should take when it comes to putting this on their pet? Like, don't put it on should they put it on the nose so they can lick it out? I mean, some people don't think about it.
They should be relatively safe, but we don't want them to slather it all over the pet's body. Basically, we want to have them treat the areas of the body that's going to be exposed. And so most likely it's going to be those non-haired areas. So the ventral abdomen, the inguinal areas, the inner thighs. I mean, if they put it on the nose, it's not a big deal. If they lick it off, it's not going to cause any harm per se, but they may get a little nauseated or salivate excessively as a result of that. But you want to apply a thin layer of sunblock onto your pets because it can cause some nausea and salivation if they are ingesting too much of that.
Okay.
Thank you. Thank you.
So you mentioned SPF. So for the human side, what would you recommend to be like a basic SPF? And if summer's almost over, but people still, go outside and swim. Once you have water on you, how often should you or you're sweating excessively, how often should you reapply it?
So we always recommend an SPF of at least 30 or higher. That was recommended by the American Academy of Dermatology. There had previously been some studies where they compared different sunscreens and their SPF, 20, 15, 30, 50, 70, and they found that some of them, because they're all made by different companies and manufacturers, depending on what else they add to the sunscreens, it can actually dilute the sun protective factor. So we at least recommend an SPF of 30 or higher to make sure that patients are having a good amount of protection for their skin. I always recommend that you should reapply your sunscreen every 2 hours, maybe even every hour and a half, especially if you're out swimming or doing a lot of sports or sweating, because that sunscreen does start to lose its efficacy. So I do see sometimes patients will put on their sunscreen before they leave the house. They'll go to a baseball game and they will say, well, I put on my sunscreen, but they still got a sunburn or even a pretty intense tan. And I will say to them, well, did you reapply? And so, sometimes they're like, oh, no, I didn't know I had to do that. So I usually will tell patients, you want to keep a sunscreen. Sometimes like for my truck drivers or people that drive long distances back and forth to work, keep one in your glove compartment, cover your hands, maybe cover your face again before you get ready to drive home. There's actually now some brush-on sunscreens, which have been very popular for the ladies and even for the men. I call it dry sunscreen, where you can actually just brush it on. And that's a great way to reapply your sunscreen and still get some protection. But of course, I prefer the cream-based ones that you put on before you leave the house because you're going to get the maximum application.
And when you said efficacy, you mean, what does that actually correlate to when someone's thinking, okay, the efficacy is going down or going up?
In terms of like the powder sunscreens versus the cream ones. So with the powder sunscreens, it's a brush. And so just like your makeup, again, we try to apply it everywhere, but you may have little skip areas because it's a powder form. So you may miss this little part here, along your jawline, or you may miss this little part on your forehead. So the cream base, putting it in your hands and really rubbing it on your entire face, it really ensures that you're getting that full maximum application. But admittedly for me, at lunchtime, I may already have powder on my face. So I don't want to reapply with a cream sunscreen because then, it's just going to look a mess. So the powder ones have become very popular to reapply. And there's even some companies that have translucent ones, so they match across a lot of different skin tones. But also my male patients really like that, because they don't want a, tan or a deep tint powder, because then they're going to be like, what are you trying to get me to do? Put on makeup, So now we have some translucent ones that are even better. And I just tell my male patients, oh, it's just a dry sunscreen that you brush on. Right. And that tends to correlate better. Or the spray sunscreens. There's aerolized spray sunscreens that I think go over a little bit better with my male patients as well.
So with sunscreen, we're trying to prevent skin cancer. And Dr. Tomeisha mentioned squamous cell. There's different types of skin cancer. There's basal cell, there's melanoma. But I remember in medical school thinking the ABCs of looking at an actual like mole, or what you would call a skin lesion. So, and it was something that I even say this sometimes to my patients, like that thing on the back of your head. Do you have somebody looking at that mole on the back of your head on a regular basis? So what are the ABCs of skin lesions that we want our viewers to know?
And this could go for humans and animals.
Yes.
Yeah.
You want to take it, Dr. Tomeisha? Or do you want, I can, either or.
Okay, it's up to you.
Okay, so the ABCs are, A is for asymmetry. So whenever you have a mole, you want to look at how does that mole look? Is it evenly brown? Is it evenly kind of like a small circle, or is it asymmetric where the shape looks haphazard or the color looks haphazard? B is for the borders. So are the borders nice and smooth? Do they jut out, in different areas? There we go. Dr. Kim's got us a nice picture. I love it.
Wait, let me see.
I love it.
Wait a minute, back it up.
Pull it back just a little bit. There we go. Yes. So are your borders nice and even? Do your borders look a little crazy? C is for color. So is the color nice and even? Is it an even light brown mole? Is it an even dark brown mole? Is it an evenly colored blue mole?
Right.
If the color is even, that's a little bit more reassuring. Is it half light and half dark brown? If it's pretty symmetric and each side being half and half, that's a little bit better. But if you have light brown, dark brown, black colors, even like whitish gray colors all mixed in one mole, that's a sign you want to have it looked at. D is for diameter. So we usually say anything larger than a pencil eraser is something you want to have examined. And E is for evolving. So if the mole starts changing, is it becoming bigger, darker? Is it becoming painful? Does it bleed on its own? Is it tender to touch? Anything that has evolved from what it previously was, when you were younger or something, that's also a sign to have it looked at.
Yeah.
That's awesome.
Yeah, I think that's wonderful. I'll just say this, and this is what I would tell patients when I practice general practice and emergency before referring to a dermatologist. I would say, look, if you have any questions about it, if it's concerning you, just speak up.
Yeah.
Don't try to go it alone and be like, wait a minute, let me write down all the things, the half even and the coloration. No, don't. If you have concerns, reach out to a medical professional, whether human or animal, and ask. It's better to be safe than sorry. It's better to know than not. So we do need to move on, because we have so much to cover. And but this is so interesting that we're gonna have to have a part 2, clearly.
For sure.
I want to go to I wanted to cover mask need, but I want to also get to flea allergies too, or allergies in general, because you got parents with kids, going back to school, and then we have people, like I said, in my current job, they always are asking me about allergies with their cats and things like that. And I used to be so nervous when I had a patient come in with allergy issues, because then there was like this whole checklist, like, what are they eating? What is their bedding? What is it? What about the skin? I was like, oh gosh.
It will drive you crazy. It will drive you crazy.
But you have to be thorough with derm. Like, you can't just give them a steroid injection and go and think. That's not okay, people.
No.
So both of you, I'd like to start with Dr. Tomeisha, but I love both of you to just spend a few minutes kind of going over allergies and what you're seeing.
Okay. So there are many different allergies that we deal with in pets. Flea allergy is the most common, and that's where your pets have an adverse reaction to a flea bite. So flea bites the pet, it injects its saliva into the skin, and then it starts the allergic reaction from there. So we tend to encourage owners to have their pet on a really good flea control year round, even though it's not all the time cold outside or all the time warm outside. In southern United States, we tend to have fleas year round. So we encourage pets to have a good flea control year round. We also deal with food allergies, environmental allergies, as well as contact allergies. I tend to see a significant amount of environmental allergies, which are seasonal allergies. So pets can have allergies to grasses, trees, moles, pollens, dust. They can be allergic to human dander. So we exfoliate our skin, it falls off and collects in the environment, and they tend to keep their noses on the ground. They're sucking that dust up in their nose. So that can cause them to have allergic reaction. We also talk about food allergies. So with food allergies, pets can be allergic to chicken and rice and beef, some of the more common allergies that we see. So we try to recommend a novel protein source for them to eat, something like a kangaroo-based diet or a venison-based diet, or rabbit. And then contact allergies. They can have allergies to cotton, wool, feathers. So if you have down comforters or feather pillows on your bed and your pet likes to sleep on the bed, they can have an allergic reaction to that. Your oriental rug that your pet likes to lay on, they get up and then they're all red and inflamed underneath. So those are all of the allergies that we tend to deal with in veterinary dermatology.
It's so funny that you mentioned human dander, because when I have patients come into me and I'm thinking maybe the pets, maybe there's something going on with the pets, I'll ask them about their pets and when's the last time they took them to the veterinarian, because I'm always thinking about pet dander. And one of my girlfriends is a veterinarian, and every now and then I'll call her about a couple of cases, and she'll start fussing at me and she'll say, "Don't blame the pets. It's not the pets." And it's so funny. I'm like, I really think they need to take their pet to the vet. And she's like, "Quit blaming the pets." But it's so funny to hear a veterinarian ask about human dander. So I will have to think about that with my patients. But I do think that dander definitely is one of the contact allergens I see with a lot of patients. I think environmental allergens are another big one, mold, pollen, dust, whatever's floating in the air. Either I can see them have reactions on their skin, or the eyes are another area where I see a lot of patients have irritation, dryness. If they rub their eyes a lot, we can start to sometimes see the little dark pigmentation or dark circles that can start to develop. So when people come in asking me about treatment for that, I will first definitely ask them about allergies, because oftentimes they're rubbing their eyes a lot. I probably see most commonly, atopic dermatitis or eczema patients in my practice. And so sometimes they can definitely have overlap with a food allergy or a contact allergy. But something else that I like to educate my families on, once we start to discuss, just gentle skincare recommendations, hydrating the skin, I start to ask them about fragrances. Are we using any of the scented detergents or fabric softeners? I try to recommend free and clear products. I tell the parents, if you like to put on your perfume or cologne, every day before going to work, you may have to save that for special occasions, date night with your significant other or whatnot, because if your kids come up and hug you, then that, fragrance could potentially irritate their skin. And then I also will ask about candles, Glade plugins, car air fresheners. Sometimes those are, things you don't think about. And if I have a family that is really compliant with everything, but we're still, fighting some flares, then I'll ask them, do you have candles in the house? You may have to bake cookies or something. But fragrances can also be a culprit that a lot of people don't think about when it comes to flaring eczematous-like rashes on the skin.
Okay. I was going to ask about that too, but I'm glad you covered it. Like about the any contact or.
Right. Nickel allergy is another one, with watches or earrings, or if, the fastener on jeans. I'll sometimes see patients who come in with a rash right around the belly button. And I saw one patient, she had a rash on the back of her thighs. And it took us a minute to figure it out, but she was sitting in a school desk, you know, the old school wooden desk that
Yes,
have those like
runner.
silver
Right.
fasteners or whatever it is that connects the wood.
Oh,
That's what
Wow.
was irritating her skin. But it took us a minute to figure that did not come easy. And then
yeah.
you're like, duh. But
That sounds like a
think
case
about these
report,
things.
a write-up.
Right.
Yeah. Well, the pets can have a nickel allergy as well. So sometimes their collars will have those
Yes.
nickel loops on them.
Yes.
And then you're wondering, well, why is the hair missing just in that area? Well, they've had a reaction to the nickel on their collars. So you have to be careful with that as well.
Wow.
So much overlap.
Dr.
Yes.
Kim, like you said at the beginning, you tried to remind everybody this how large of an organ the skin is, and it's so important and can cause, you know, it's a great thing, but it gives you a lot to work with in terms of your specialty, because there's so many different issues that can come up and come into play, and we just really want to encourage our viewers, if they're concerned about allergies, skin infection, acne, anything that's going on with your skin, don't wait, don't delay, don't just keep putting the same products on and not getting any different results. Don't keep thinking, you know, as far as pets, that you can throw on some flea powder or just, you know, things will magically go away, because that could actually be causing more irritation than it can be helping. So please, 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 people don't really think about dermatology as a specialty, but it's so important. So please, while they're wonderful general practice, primary care physicians and general practice veterinarians, you know, please talk to them about the possibility of seeing a dermatologist or someone who specializes in dermatology. If your pet or the human in your life is experiencing the same problems especially that don't go away. So that's my plug for dermatology.
Absolutely. And hair loss, Dr. Priscilla. I was going to say,
thank you.
Hair loss is another one where, as dermatologists, please come see us as early as you notice it or your hairstylist mentions it. Don't wait. Don't try to hide it. You know, come see us so we can help you and, you know, get you on a treatment plan.
No, that's really good. Do you have is there anything we should know real quickly about hair loss in terms of like age? Or I know women, like we haven't been going as often to the stylist. I've been going with my mask on. I think Dr. Kim was there with her mask on the other day.
Goggles.
And
goggles.
But is there anything in particular as far as age-wise in terms of women that we should be looking at in terms of hair loss, or anything specific that we can?
You know, it's interesting because before it used to be that we would see it in sometimes older populations, well, not older, but, you know, like 40s, 50s, a little bit older than that. But now there are certain types of hair loss that we are seeing in younger patients and even in young girls. And some of these are some of the scarring types of hair loss, because with hair loss, we always try to put it in a scarring form or a non-scarring form. What I always tell patients to look for is ask your hairstylist or listen to your body. You know, Beyonce has a song, I mean, pretty shouldn't hurt. And so when it comes to your scalp, if your scalp is itchy, if it's tingly, if it's tender, if you have a spot that is always sore, that is a sign that something is going on. You know what I'm saying? Because it wasn't always like that, you know, ideally. So, you know, listen to those symptoms, or if your hairstylist mentions something like, you know, this patch is really starting to thin, or if you know there's a family history maybe of hair loss, either in the women in the family or the men, you know, that's a reason to go see your dermatologist. You know, a lot of times there are some people that will try to camouflage it as much as they can, and by the time they get in to see us, the area has gone from being, you know, from a little piece of hair loss to a larger area. And then, you know, it's a different type of conversation we're having with patients on what the diagnosis is and realistic expectations. But the earlier you can get in, even just to have your scalp examined. I mean, when I do a skin check or a full body skin exam, I am taking a Q-tip and I am going through the scalp as well, because I need to see that part of your skin as well. So just making sure that you're listening to your body.
Yeah, Dr. Tomeisha, any other closing thoughts on that before we get to the last part of our segment?
Well, anytime we see hair loss, we want to do a full dermatologic examination. So, we start off by doing skin scrapings to rule out parasites. We take skin cytologies to determine if there's secondary bacterial and or yeast infections. And in some cases, we want to rule out fungal infections such as ringworm that can contribute to hair loss. And so we may end up doing some type of fungal culture that has to set up for about 2 weeks before we know the results of that. And if, a patient has hair loss and it's been treated with the normal therapeutics and we're not getting the correct results, then we may end up doing something like a culture of the skin in order to identify what bacteria are growing, what's the best medication to treat that actual bacterial infection. And then we may have to move on to a skin biopsy. So we use biopsy punches to take little pieces of the skin to submit to a dermatohistopathologist who reads the samples and let us know what the changes in the skin are consistent with. And then we make our recommendations based off of that.
Yeah, no, that's good stuff. And please, these doctors are on Instagram. Please follow them. Dr. DiAnne is at Dr. DiAnne Davis. Dr. Tomeisha is at DermVeto2. They put out information, good information for you to consider. And they're dropping a lot of knowledge today, and we will have to have them back because I have more questions.
Right.
I love it. We could talk about skin all day.
All day long.
Every day.
So Dr. Kim, you want to take it away? I know we wanted to cover 2 more things as we close.
One last thing that's a little more ominous would be melanoma. And I know it's something that is, a lot of people say, oh, I had a little skin cancer and they cut it off and it's fine now. But melanoma is different. The most famous person I can think of that actually died of melanoma would be Bob Marley. Can we talk about, melanoma, how it's different than other skin cancers, and what you need to look for, and like Dr. Priscilla said, if you have a question, if you have a concern, talk to your doctor about it. But what's different about melanoma in animals, or in pets and in humans?
Right. So, melanomas can be malignant, they can be benign, but if you're seeing a dark colored growth skin lesion on your pet, then it is something that we need to be concerned about. Melanomas are basically an overgrowth of the melanotic cells. So the melanotic cells in the body who produce the pigment in the body are pretty much going haywire. So you're getting an abnormal reaction in the skin of those cells that produce the pigment in the skin. And so if you're seeing darkly colored raised lesions on the skin in your pet, especially if they're located on what we call a mucous membrane, where the haired skin of the body meets non-haired skin. So you can see that around the lip margins, around the eyes, the nasal planum, maybe even on the paw pads. But those lesions around the mucous membranes, those lesions on the digits, tend to be more malignant in those areas. And so if we're seeing those darkly colored lesions pop up on the pets, then we need to perform a biopsy or completely remove those lesions to submit to the lab to identify whether it's malignant or if it's benign. And we want to remove as much of it as we possibly can so that we can eliminate the fact of it coming back or reoccurring. And so the best that we can do in those digits sometimes is maybe prescribing something like a chemotherapy or some sort. But most of the time we try to go ahead and remove the entire lesion so that they don't come back.
Right. So with melanomas in humans, and in particular in Black people, I'll talk about for skin of color patients, melanoma accounts for 1 to 2% of all skin cancers in Black patients. I think it's like 2 to 3% in Hispanics. But why we talk about it so much more and why it's important for us to be aware of it is because Usually when people of color are diagnosed with a melanoma, they're diagnosed at a later stage of the melanoma because cancers all have different stages.
Right.
So usually they're diagnosed at a later stage. That's for a number of reasons. But again, our skin, we already have more melanocytes in our skin. Oftentimes, though, with melanomas, they will present themselves in areas that may be a little bit more hidden. So it may be that it wasn't diagnosed until it's at a later stage where it's bigger and then you notice it, or it's an area that you just don't check that often. Because they're diagnosed at a later stage, the rate of survival is also lower in skin of color patients. So I think for African Americans, if their melanoma is diagnosed at a later stage, they have a 65% survival rate versus Caucasian patients that will have a 91% survival rate. So that's why it's important for everyone to do their own self-skin exams. But again, if you notice something that looks different, then you want to go and see your dermatologist. In particular with skin of color patients, oftentimes melanomas are going to present again, like Dr. Tomeisha said, sometimes the mucosal surfaces, the palms of the hands, the soles of the feet, the groin, sometimes even under the nails. So if you notice a spot on your nail, you want to maybe have that examined. I had a colleague who diagnosed 2 melanomas in the genitalia of a couple of patients. So, sometimes I have patients, they come in, I ask them that I want to do a full body skin exam, looking at, at every part. And sometimes I have a little bit of hesitation and I just have to explain to them, we will sometimes diagnose things in some of those, more private areas or intimate areas, if you will. So it's good to just have us look and examine those. But again, it's really important. Yes, Black people can get skin cancer. And so it's important for us to be aware of that as well.
Thank you.
Okay, so it's 10 till, and there are some things that we wanted to discuss that are a little more fun. I know tonight
I know skin is fun.
This is fun.
More lighthearted.
Lighthearted. Let's do a better word. So we all have our T-shirts on, and we're going to talk about those. And then tonight, Patti LaBelle and Gladys Knight are having a battle. And so we want to kind of, as we talk about our shirts, who we have for that battle, who do you think is going to win? Okay, go, Dr. DiAnne, go.
Okay, so I'm talking about my T-shirt first, okay? So I'm going to stand up. Oh, I don't know if you guys can see it, but it's a black fist with beautiful pink nails. I tried to get my lipstick to match. And I am blanking. Black Vibe Tribe, I believe, is the maker of the shirt. And so I wanted to wear this just again, because Black Lives Matter. I am supporting my Black sisters, my Black women in medicine. We're all supporting each other. And so I decided I wanted to wear this shirt today. And I have Patti LaBelle. I have Patti LaBelle for the battle tonight. I am obsessed with Miss Patti, and I think she's going to win.
Okay. Go ahead, Dr. Tomeisha.
All right. So my shirt says, "Stroll to the polls." This is a serious matter. It's definitely serious. We need to make sure that we are going ahead and exercising our right to vote. It's the only way that we can implement change. So if you feel like we need change, the only way we can get that change is if we make a difference. And so we have to go out and exercise our right to vote. And so we're encouraging everybody to do that. And I also have Miss Patti for the versus battle. I mean, the notes that she can hit are unbelievable. So I think she's going to do some things with her voice tonight that we probably haven't heard before. And I think Miss Patti is going to take it home tonight.
Love it.
Okay, Dr. Priscilla, what do you think? And this is your shirt.
Okay, my shirt is a representation of my university. I'm a double Tuskegee graduate. I also have degrees from 2 other places too, but this is where I got my start at Tuskegee University. That's also where I met Dr. DiAnne and tried to woo her into coming to Tuskegee University.
And she did. That's where I went. TU.
And we're so honored to have her walk the campus at Tuskegee. Have such great memories of undergraduate and veterinary school. And because both of our special guests had that Tuskegee connection. I could not think of anything better than to pay homage to my alma mater. So I was really happy to do that and happy to have both of you on. Very honored. And we've been blessed by all this knowledge I've been dropping. As far as verses, I'm gonna go with the underdog because I feel like last night hasn't gotten any love. Everybody's been rooting for Patty, and she's obviously amazing, but I don't think people really know the full catalog of Miss Knight and all the work that she did. I don't know, I just think her music wasn't out there as much, like people like, you know, our parents playing like Last Night in the Pips, thing on a midnight train to Georgia. But I'm sure I'm excited because I want to hear more of her catalog, and I just think she can hold her own. But of course, I mean, everybody knows Miss Patty LaBelle, so I mean, yeah. But I gotta give it to Miss Knight. I gotta root for the underdog. Sorry.
Well, I mean, I appreciate you rooting for the underdog.
So she's about to go in. This is my older cousin, so
that leads me into my T-shirt. My T-shirt is representing a virtual 5K for the Annie Malone Foundation. And so that's a foundation, and I don't, if you know who Annie Malone is. Annie Malone is actually the mentor of Miss Madam C.J. Walker. And she is the woman who was actually behind Madam C.J. Walker's success. And she was actually more than likely the first self-made Black millionaire in the country, not Madam C.J. Walker. The Annie Malone Foundation is an organization that fights hunger, fights child abuse, and it's based in St. Louis. One of our past guests, Miss Melody Moore, she is the chairman of their this not-for-profit. And so it's a really important organization that's doing really great work in St. Louis, Missouri, which is where my husband's from. And so I wanted to highlight that organization and the history of Annie Malone. Yeah, so Patty, I'm gonna go with her. There's like several songs, like if she does and around, I've been looking around. If she sings that song, You Are My Friend, that's it. You Are My Friend. If she sings it, it's over. It's over.
Yes.
She brings out some duos like with was it Michael McDonald, On My Own?
Yes.
that won't be fair. You can't do that.
Yes.
That's a game changer. It's a game changer, and it's
I'm
game
not arguing against you. I'm just trying to give Miss Knight some love. That's
okay.
all.
Let's give her some love. She makes some really good chicken and waffles.
Well, we can say that both of them have aged gracefully.
That's right.
Yes, like what
really
are their
good,
secrets? What are they?
Look at you, y'all dermatology people.
Yes.
They have aged great.
We need their secrets. No, they look
Yes, we
phenomenal. Yes.
Yes, we need all their secrets.
Well, thank you so much, Kim. You want to close it out? I've already said my thank yous. Dr. Kim, do you want to close us out?
Well, thank you again for giving us your knowledge about skin, about the importance of taking care of your skin, the good and bad and ugly of skin. Not ugly, but everybody, you know, things that can go wrong with your skin. And thank you guys for listening in today. We want you guys to subscribe to MD plus DBM. Go to the YouTube page and hit subscribe. All of these episodes, this is episode 7, but 6 through 1 are also available on YouTube for you all to watch in, as my favorite word, perpetuity. So you all can watch it whenever you have time and learn and understand your body, your pet's body, and that we are all earthlings on this place. So MD plus DVM is about human health, pet health, one health, and we're doing this to save the world. So thank you so much, and we'll see you guys next time.
Yeah, see you then.
Absolutely.
Thank you.
Thank you.
Thank you for having us. It was a lot of fun.
Awesome
Thank
fun.
you. Thank you.